A complete thyroid test would include the following: whether there are high, average, or low thyroid hormone levels, hyperthyroidism, Hashimoto's, euthyroid, hypothyroidism. Most patients complain of hypothyroidism-like symptoms than any other type of thyroid problems. Hypothyroidism is commonly underdiagnosed and undertreated because conventional physicians believe that these patients are healthy as long as their hormone levels, specifically thyroid stimulating hormone, TSH, are just within the so-called conventional boundaries of laboratory reference ranges. For reason, our functional and integrative medicine or medical physicians think otherwise because they don't want patients' levels to be within the reference ranges. They want their hormone levels to be optimal. Also, it is merely impossible to make an accurate diagnosis or prognosis on a patient just obtaining TSH values. To have a solid overview of a patient's thyroid function, the physician must test for thyroid stimulating hormone, TSH, free T3, free T4, thyroid peroxidase, and thyroid antibodies, optional reverse T3. They are all interrelated and provide a definitive look at what is going on with the patient's current thyroid health status. TSH. This test is performed to determine the cause of abnormal thyroid hormone levels to screen for an underactive or overactive thyroid gland. By measuring the level of TSH in the blood, we can determine how well the thyroid works. Free T3. A free T3 test is used to assess thyroid function. T3 is the active form of thyroid hormone that influences many body processes, particularly the regulation of your metabolism. Free T4. A free thyroxine or free T4 tests are used to help evaluate thyroid function and diagnose thyroid diseases, including hyperthyroidism, upregulation, and hypothyroidism, downregulation, usually after discovering that the thyroid stimulating hormone, TSH, level is abnormal. It also gives us a complete understanding of what is going on with your thyroid. Thyroid antibodies, TPO. This test is for autoimmune thyroid disease. It can be detected in Graves' disease or Hashimoto thyroiditis. In autoimmune disorders, your immune system makes antibodies that mistakenly attack normal tissue. Thyroid peroxidase AB. Thyroid peroxidase is a test that measures the level of an antibody that is directed against thyroid peroxidase, TPO. Autoantibodies to thyroid peroxidase, TPO-AB, are produced within the body. The presence of TPO-AB in the blood reflects a prior attack on the thyroid tissue by the body's immune system. Next are micronutrients like vitamins and minerals, why and what you need to know about them, and how they go hand in hand with HRT therapy. Most people underestimate the power of vitamins and minerals. You need to understand micronutrients and that they lubricate all the biochemical wheels of life, and without them, you would die. Nutrients can become biological response modifiers as they change and adapt to how the body is currently working and feels. When you are deficient in them, the body slows down in every shape and form. One of the anticipated consequences of nutritional deficiencies is weight gain and disease susceptibility. To name a few examples, deficiencies of key nutrients like B vitamins and magnesium causes fatigue, which impedes caloric expenditure. A low level of coenzyme Q10 slows mitochondrial activity. Low levels of vitamin D are linked to obesity. Insulin resistance worsens with low omega-3 fatty acids, magnesium, and chromium. These are just a few examples, but hopefully you get the point. Here are the vitamins and minerals we look for. This is to name a few, but we hope you get the point by now. Here are the vitamins and minerals we look for. Vitamin D, 25-hydroxy. Vitamin D is a nutrient essential for maintaining healthy teeth, bones, and neuromuscular function as we age. Optimizing your vitamin D3 helps lower SHBG, promoting more free testosterone, the beneficial testosterone. Low vitamin D levels have been shown to cause suppressed immunity, increased risk of chronic diseases like heart disease, and several kinds of cancer. Vitamin D also regulates inflammation throughout the body, which is extremely important because it is believed a high percentage of diseases are inflammation-based in the first place. Vitamin B12. This vitamin test is essential to identify the normal formation of red blood cells and your nerve tissue's health. B12 acts as a cofactor to produce energy and dopamine, a neurotransmitter that plays a major role in reward-motivated behavior. Also, it helps produce cellular energy. DNA/RNA maintain healthy vision and many other health benefits. Undetected and untreated vitamin B12 deficiency can lead to permanent nerve and brain damage. Homocysteine levels tend to be elevated in vitamin B12 deficiency patients. Never supplement with cyanocobalamin B12 because too much of it can suffocate your brain. The most active coactive enzyme form of B12 is methylcobalamin and is the recommended form you should be taking. Magnesium is a cofactor in more than 300 enzyme systems that regulate diverse biochemical reactions in your body, including protein synthesis, muscle and nerve function, blood glucose control, and blood pressure regulation. Furthermore, it's required for energy production, muscle contraction, blood coagulation, nutrient metabolism, especially carbohydrate and bone cell formation. A complete diabetes test would include the following. Hemoglobin A1C. This test provides information about a person's average blood glucose levels, sugar, over the past 3 months. For people without diabetes, the normal range for the hemoglobin A1C level is between 4% and 5.6%. Hemoglobin A1C levels between 5.7% and 6.4% mean you have a higher chance of getting diabetes. Concentrations of 6.5% or higher mean you have diabetes. The good news for you is that we have an excellent protocol that can mitigate and, in some cases, completely reverse diabetes for those that suffer from it. Insulin. Insulin testing has several important uses. Insulin is the body's primary energy source, and it helps transport sugar, or glucose, from the blood to within cells. The higher your insulin levels are, the more likely you are insulin resistant. If so, your body starts to age and deteriorate faster than average. Insulin resistance is the single most important phenomenon that leads to rapid premature aging and leads to diseases, including heart disease, stroke, dementia, and cancer. Insulin resistance and the resulting metabolic syndrome often come accompanied by increasing central obesity, fatigue after meals, sugar cravings, high triglycerides, low HDL, high blood pressure, problems with blood clotting, and increased inflammation. Doctors rarely order it, and they usually don't express concern until blood sugar, or glucose, is over 110 or worse, over 120, which is diabetes. Glucose is another test indicator we look for and falls under the CMP panel. Other indicators of disease we look for are not necessarily tied in closely with hormone replacement therapy, or HRT. Homocysteine. High levels or abnormal accumulation of homocysteine are linked to the early development of heart disease, MTHFR, and age-related brain shrinkage. It's also associated with low levels of vitamins B6, B12, and folate. The good news is that we can treat these abnormal levels with our proper treatment protocols. C-reactive protein, CRP. This is a blood test marker for inflammation in the body. High CRP levels can indicate that there's inflammation in the heart's arteries, which can mean a higher risk for a heart attack. Besides, a high level of CRP can be caused by a wide variety of conditions, from infection to cancer. Ferritin. A ferritin test helps your doctor understand how much iron your body is storing. If your ferritin level is lower than normal, it's an iron deficiency indicator, which causes anemia, a reduction in the number of red blood cells. If you have cancer, kidney failure, or other chronic conditions, you may be at risk of anemia or other related chronic diseases. These conditions can lead to a shortage of red blood cells. Also, slow chronic blood loss from an ulcer or other sources within your body can deplete your body's store of iron, leading to iron deficiency anemia. High levels of ferritin can indicate an iron storage disorder, such as hemochromatosis or a chronic disease process, which is very rare to find in a patient's blood work result. Here is the typical blood work ordered in conventional medicine and that a general physician will assess a patient's overall health. Now, after everything you just heard, if you really want to check your overall wellness status legitimately, do you think that only checking for CBC, CMP, and lipid panel alone is going to tell you a whole lot about your health? At this point, we can agree that it would be ridiculous to consider, and what we really want is the bigger picture. However, these following panels provide some valuable but limited information about a patient's current health status, just not merely enough to make a full assessment of a patient's complete wellness status. Part of our blood work test includes these traditional blood panels as well. Complete Metabolic Panel, CMP, measures 14 different test panels that give our doctor valuable information about the current status of a person's metabolism, including the health of the kidneys and liver, electrolyte and acid or base balance, as well as blood glucose. Glucose is a type of sugar your body uses for energy, and electrolytes keep your body's fluids in balance. Complete blood count with differential. CBC with diff. This test measures red blood cells, white blood cells, platelet levels, hemoglobin, and hematocrit count in the blood, screening for anemia or detection of infections. This test is vital for patients who are administering testosterone replacement therapy themselves because long-term overuse of testosterone causes polycythemia, an abnormally increased concentration in red blood cells, and causes your blood to thicken. That makes you more likely to develop blood clots, stroke, or suffer from a heart attack. However, this could be avoided by routinely donating blood every 3 to 6 months, depending on the patient's blood work results. Lipid panel. This test measures the amount of cholesterol and triglycerides in your blood. High cholesterol levels usually don't cause any signs or symptoms. Nevertheless, high cholesterol levels could obstruct blood flow through the arteries, increase cardiovascular disease, and stroke risks. Lipids include cholesterol, high-density lipoprotein, HDL, low-density lipoprotein, LDL, and triglycerides. A lipid test is a valuable test to determine a partial section of the patient's health. So there you have it, a comparison between the conventional blood panels that doctors usually give you or the more comprehensive ones that we recommend. If you found this video informative and would like to inquire more about the blood panels that we could administer or to discuss HRT therapy in general, please click the link below in the description of this video. You can contact us using our contact form or our telephone number on the webpage.